Sports physical is a physical that is allowing a provider to look at a student and see if they're prepared to be able to play the sport they're going to participate in. There's so much anxiety, depression at this day and time. So it's very important, especially if you're doing it one-on-one with a provider in one of our clinics, that opportunity to explore a mental health history, a social history with drugs and alcohol, even possibly sexual history, just a lot of health maintenance things that could be uncovered and taken care of in that conversation. Mostly it's a historical gain, so you're telling people what's going on in your life and also what's going on in your family's life, your family's medical history. And then they're going to examine your heart, they're going to examine usually your lungs, your belly, examine you orthopedically, meaning how can you move, what hinders you, if anything. So you may have to squat down, they may check your neck, they may check your shoulders, your biceps. So just a general kind of screen, and then they would anything they uncovered, they would hone in on that joint. I think it's very important to let us know at the time of a wellness check or a sports physical that you've had COVID or that the child, young adult has had COVID, because there's so many things that we're finding that are lasting effects. And so it's interesting because the fatigue, the shortness of breath, those things should be uncovered as we ask our history and we look at the review of systems and make sure that they're not having any symptoms that would kind of detect, allow us to detect something might be wrong, need further evaluation. But it's definitely important to make that known as far as historically, and it really should be asked at this point, just the new normal, if you will.